Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine, one of the large medical schools in the United States. Today we're going to look at a great article published in the British Medical Journal about the title, Regular Use of Fish Oil Supplements and the Course of Cardiovascular Disease, a Prospective Cohort Study. When you look at the fish oil, there's always different of opinion. There's a lot of studies up there. Some studies have shown there is benefit, some studies no benefit and all that. So a lot of elderly people take fish oil as one of the supplements again. The main purpose of this study is to look back and see, does fish oil supplement has any benefit in the cardiovascular diseases, okay? So we're going to talk about a great study published in the British Medical Journal. Now, the name of the study again is the Regular Use of Fish Oil Supplement and Course of Cardiovascular Disease, a Prospective Cohort Study. And let's recognize the primary author is Dr. Chen and the senior author is Dr. Lin, okay? Now, the study question, the researcher, or we call it the hypothesis, does fish oil has any benefits in the cardiovascular disease? When we talk about cardiovascular disease, they mainly look at atrial fibrillation, CHF, stroke, and myocardial infarction. Okay. Now, where did they get these patients for this study? This is a prospective study. There was a survey done in England. It's called a UK Biobank. There's around 500,000 participants. They asked like a lot of questions and put it in the data bank so the research can look at the data and do the analysis. So they took the patients from this data. In this study, there was around 415,737 patients exactly, okay? They did take some of the people who has atrial fibrillation or stroke at baseline. So the next question they asked the people in the survey, or there was a survey question already, do they have taken any fish oil supplement? They did not ask like what dose they were taking. The question, again, it's a survey question, were you taking any fish oil supplement? Okay. Now, what are the outcome? They looked at the cardiovascular outcome. The cardiovascular outcome include atrial fibrillation, CHF, stroke, MI, and death. All these parameters, they looked at it. Now, we look at the statistical path of the study. They did like the test they used, the chi-square, they did do the t-test, and they did a multivariate regression model adjusting for all the variables. And then also they did the survival analysis. So very strong statistical study. The results, the main result they found, fish oil supplement by taking fish oil supplement can lead to atrial fibrillation. The hazard ratio 1.13 with the confidence interval 1.10 to 1.17. Please look at the confidence interval. This is so narrow, that means less variability. Is a very strong study. So the bottom line, 13% more likely to get atrial fibrillation if you are taking fish oil supplement. Okay, now let's look at the strength of the study. The main strength of the study is a large number of participants, and they did adjust for all these co-variables, age, sex, and the alcohol use, smoking, and all of that. The statistical analysis part is also very strong. They have created this model, multivariate regression analysis. And they are, again, we talk about adjusting for the co-variable. And long follow-up, this patient followed up for 11 to 13 years. So it's a good period of time for follow-up. And they also, a lot of places like death registry, the numbers like mortality, where do they get it from? In England, they have a very good death registry, so they can go back and look at it. Okay. Now the weakness of the study, again, it's a survey, it's a retrospective or it's a prospective study, but it's a survey. Most of the questions, like, sometimes the patients cannot remember when you ask them. Recall bias is always going to be there. And then they just ask, do you take fish oil? They didn't ask how many times you take him, what dose of fish oil supplement. Are they taking the tablet? They're taking the capsule, okay? Did not account many of the other variables, unfortunately. A lot of things can cause atrial fibrillation, like mainly the thyroid disease. So they should have looked at the people who are making the TSH. They should have looked at the people with obstructive sleep apnea. Coronary artery disease, a little bit more carefully. And the valvular disease, they did not look any of that. And So what is the take-home message of this great study? The atrial fibrillation and the link with the fish oil supplementation. So people who are taking fish oil supplement, they are at risk for cardiac arrhythmia, which can lead to atrial fibrillation. And this is, again, we need more studies to be done. But this is a study, have some significant, I did like the confidence interval is very, very narrow. It's a very strong result. So anytime, more studies definitely needed, but again, you have to be very careful. Maybe instead of taking the fish oil tablet, maybe you want to consume fish, because when you talk about tablet or capsule, they're covered with the plastic, and plastic can cause cancer and a lot of other complications. So we never know what exactly the benefit inside when they will make the capsule. So it's important, definitely there's a lot of benefit we're taking. Why not taking regular fish rather than taking the supplement some company made it? We don't even know how they make it and all that. Again, the bottom line, fish oil supplements can cause atrial fibrillation. More studies, randomized control needed. Thank you so much for watching. We'll be back with another presentation. God bless.